Now, I just want to make sure we've got the facts right for viewers just tuning in. And it says the government will be distributing masks to all Singaporean households, not all Singaporeans. And the number of masks will be 4 to each household. And that will be a one-time distribution. So my question is, why 4? And does it have to be a one-time distribution?
Well, what we're going to do is we're going to make sure every home, every household in Singapore gets a pack with 4 surgical masks in it. And what we're hoping that the residents do when you receive this is not just to open it and use it straight away. The purpose of these masks is if you are sick and then need to go and see a doctor, that you have a mask to take with you on your journey there. When you go to see the doctor or the polyclinic, the hospital, you'll be given another mask and as many masks as you need. The message we want to send is that use the mask if you're unwell. If you're well, don't use a mask and don't worry about whether you need to go and get a mask. We're putting that mask in your hand. So you don't need to go and join these long queues to stock up on masks just in case. We're putting a mask in your hand. If you're sick and you need it, it's there.
Dr. Janil, it's natural for people to want to protect themselves. That's our natural instinct, especially at a time like this where there's so much concern. Now that, we know that Minister Chan Chun Sing, for example, said we understand that people are fearful right now. What's at risk if the government doesn't get this cooperation from Singaporeans?
Well, the first thing is we want to help people protect their own health and way of life and livelihood. And washing their hands, washing all of our hands, practicing personal responsibility, personal hygiene, and getting on with all the other things that we have to do is important. That's the first message. The second is that we are taking steps to protect Singapore and Singaporeans. And you've seen an escalation of what we've done in terms of restricting travel to China and completely restricting travel, restricting travel to Hubei and Wuhan, and then giving an advisory for the rest of China, and then removing the visa arrangements for people incoming. Each of these are designed to protect and reduce the exposure to Singapore from the outside. But within Singapore, that aspect of personal hygiene and personal responsibility is very important. The other thing that we're doing in parallel, of course, is everything's on standby. All our healthcare facilities, our hospitals, our GP, everybody's on alert looking out for this. And we can all play our part in that as well. If there are people who are sick, we have to find ways to look after them.
Yeah. Is the anticipation that Singaporeans will come forward to support this distribution campaign? Because we all come from different size households, and at the bottom line is we would still feel comfortable having more than less. So that might make them go online, and then you have this whole situation about profiteering retailers, and then they might also prefer perhaps to stay home if they don't have sufficient masks, and then that might have a knock-on effect on businesses.
So that's the point. We want to come down very hard on profiteering and price gouging, and I know the online platforms, the retailers are trying to do something about this. My colleagues in the economic agencies and MTI are also going to come down very hard on this. This is not something we can countenance. The exploitation of a crisis for this terrible way, profiteering, is just inappropriate. But in terms of the number, as I said, it's not a pack that you get and you open it straight away and I give one to you and I give one to you and I give one to you. No, keep it safe. And when a person is unwell, then that person should use it and go down. And what we hope to do is reduce the anxiety that drives people to go and stock up on hundreds or boxes and boxes and boxes just in case. And the message we want to send is the mask that you need just in case, we're putting it in your hands.
I mean, Dr. Janil, what you say is so true, but online there's been a lot of discussion of this entire issue of face masks, hence some paranoia, as it were, of stockpiling and hoarding and so on. There's also been some online discussion about Singapore's immigration officers at checkpoints at the airports. These are people who meet thousands of international travellers every day. There is talk that they're being told not to wear masks at those checkpoints. I mean, can you comment on this?
Well, when I went to inspect the various checkpoints at Changi and Woodlands and also the Marina Bay Cruise Centre, indeed our frontline officers manning the stations, doing the thermal scanning and inspecting the passengers as they come off for illness, they are wearing masks. And that is correct. The frontline officers looking at these areas of risk, we want them to carry on their duty, whether or not someone is cooperative or coughing or at risk, and that mask helps them do that. And that's very different from the rest of us who are well. I'm well, you're well, we don't need a mask at this point in time. It's not going to help us. But of course, what will help us is hand washing.
Okay.
We'll have some time to talk about that. I have some things to say about that if you want to talk about that.
Well, also want to talk about how the government plans to ensure that this process is equitable
Indeed.
across all households. I mean, such that, you know, everyone gets what they're supposed to get.
Absolutely. And actually, it is that equitability of access that is a key reason why we're doing this. Right now, the masks that are being provided to the retailers and the various other distribution channels, they're not being distributed out equally to all Singaporeans. The people who are getting them are the people who are willing to queue and queue again and queue and get and keep them for themselves. Now, this process that we're hoping to put in place, that we are putting in place, will get one pack to every household. And we're doing that through the RC centers, the resident committee centers, as well as the community centers, because we have them distributed throughout our country, in every estate, in every division, in every town. And so you don't have one congregation point, people can go to a collection point near them. What we're going to do is track the address of the person that comes to it to collect, and then each household, each address gets one pack. And that's the way we're trying to be very fair and equitable across our entire resident population.
While we discuss what we know and what we don't know about this coronavirus, Dr. Janil, we also know that there are bio-research teams around the world who are trying to develop test kits as well as vaccines. Where are we with that here in Singapore?
Well, indeed, it's quite different with this virus compared to SARS, for example, where it took us days or even weeks of observation and tests to come to a conclusion about whether someone was at risk or free of SARS. Here, it's a matter of hours before we're starting to get information and a matter of days before we have some certainty. The technology has advanced. And so we have researchers around the world, China and the West, various other places, and they're looking at a variety of aspects. How can we study this disease to know what's going to happen? How can we think about preventing this disease spreading? And then what is the treatment for the sickest patients? We are plugged into that research community, we're plugged into that academic community, and we benefit from all of that information, which today, we also have the internet and social media, and that's sharing all this information in real time. That's not something we had when SARS was with us, or when some of the other troubles that we had faced were with us. Of course, that also means that there's quite a lot of disinformation around.
Yes.
And getting back to your earlier point about anxiety, we do have to now proactively make sure we inform Singapore and Singaporeans about this information, getting the right facts out there, getting the truth out there.
Yeah, because, you know, there is a difference between SARS and the Wuhan coronavirus, and one of the obvious ones is the incubation period being longer, but yet the fatalities not being as high. Aside from that, I've also heard it described as not as serious, like perhaps compared to the flu in terms of the fatality rate. Would that be a fair description?
Well, indeed, this is not the same virus as SARS. It's not the same fight. The fatality rate is about 2 to 3%. For SARS, it was about 10 to 15%. It's a whole order of magnitude different. And that's the data that we're getting from around the world. And associated with that, indeed, it spreads a little bit easier than SARS. So you can pass it on a little bit easier than SARS, but it's not perhaps anywhere near as fatal. The incubation period, well, we're thinking it's about up to 14 days, but some of the data is suggesting somewhere between 5 to 7 days. So we're not entirely sure. It may be shorter than that, but the 14 days gives us a bit of a buffer to make sure that someone who's quarantined, isolated, actually is clear of the infection before they're removed from quarantine.
I've just got one quick final question for you, Dr. Janil. Do you think that the fear, the anxiety that we're seeing, and I want you to talk about what we're seeing here in Singapore for Singaporeans and PRs, for everyone who's here, do you think that that anxiety is outpacing the actual danger right now here in Singapore?
Absolutely, absolutely. Let's recount the facts, okay? We have 13 confirmed cases here in Singapore. Every single one of them has a direct link to Hubei or Wuhan. There has not been local transmission here. There has not been community spread here in Singapore. Now, on top of that, you look at the 13 of those patients. Their condition is stable. Most of them are improving. What does that mean? It means they're not hooked up to machines, lying on a bed. You know, they can drink their Milo, they can feed themselves, they can read a book, maybe watch this broadcast.
So could you confirm that none of them are seriously ill?
That's right.
Now?
That's right. All their conditions are stable.
Okay.
So that doesn't mean, however, that the anxiety you talked about is not serious. Actually, if that anxiety gets out of control, it can be more damaging to our country than the disease itself. And that's one of the reasons why we're putting all these steps in place, trying to calm our fears and rally Singaporeans together.
All right, we'll leave it there. Thank you so much for your time. We've been speaking with Dr. Janil Puthucheary, Senior Minister of State for Communications, Information and Transport.